Now, if you receive child benefit support, you'll see your payments increasing from today. In this year's budget, a 2.2% uplift was announced, as well as increases to income thresholds. Almost 5,800 families on the island currently receive the benefit, around two-thirds of which have a household income under £50,000. Well, the Treasury Minister, Alex Allinson, joins us to discuss how these changes will impact Manx families. Minister, just how many families do you see this change actually helping?
Well, it depends because, again, you've said that some people who are on child benefit, their rates will go up. They will do. What we did last year was increase the rates for second or subsequent children, make them same as the first. But what we've also done, as you say, is change the thresholds as well. And this is the first time we've done this in a decade. So it used to be that you got the maximum if your household income was £50,000 or less. That's gone up to £60,000. And also, if you're earning under £90,000 in terms of your household income, you can now claim child benefit. So it will affect an awful lot of people. We think that the increase in the 2.2% is an additional £297,000. The threshold increase is an additional £1.2 million. And so it's really trying to put more money into the pockets of working families.
We know money is tight at the moment, though. Where are those funds coming from?
These are coming from our revenue, so they're not coming from the National Insurance Fund. This is putting money in people's pockets through some of the economic growth we've seen, and really goes along with the Island Plan in terms of making this a great place to live and work, but also ties in with some of the other things that this administration's been doing, like the childcare strategy, like giving childcare credits to those 3 and 4 year olds as well as the 4 and 5 year olds.
Now, the 2.2% increase, we know the inflation rate is currently at 2.6. It's fluctuated a bit over the last year. Is this going to be making that much of a difference, or is this just increasing the benefit to match the rising cost of living?
It's a help. I agree with you that, we tend to upgrade our benefits in line with the September rate of inflation, as they do in the UK. Their rate of inflation was 1.7%. So their benefits have gone up by that. Ours was 2.2%, so ours have gone up a little bit more. It's an extra 60p a week for the average claimant who are on the full amount, but also by changing the thresholds, we've actually put more money in people's pockets with households who are earning £60,000 or £70,000 combined.
You touched on some of the additional support that's been put in place over the last year. We saw recently the figures on the birth rate on the island. It dropped again last year. Do you think there is still a lack of support for those who are looking to start a family?
I think when you look at working families, there are a huge amount of pressures there. We can do some good in terms of things like child benefit, things like the childcare strategy. But one of the big things that are affecting people are housing costs on the island and the availability of accessible housing. That's why a lot of things in the Island Plan are looking at housing, but why also we need to increase the minimum wage. We need to increase median earnings so people can afford to have a really good standard of living on the island.
Now, over the weekend, the Isle of Man Medical Society shared its concerns about the implementation of an NHS levy on the island. It believes the tax is regressive and risks widening existing inequalities by placing a disproportionate burden on vulnerable people. Now, you're looking at this at the moment. There's a consultation open on these proposals. What do you think of these concerns from the Medical Society?
Well, I'm very grateful for them for emailing me over the weekend with their concerns. I think they've perhaps taken the wrong end of the stick because they're talking about flat rates and charges for going in and seeing your doctor, and those aren't anything to do with the consultation levy and certainly aren't policies of this government. What the consultation is doing is looking at adequate ways of increasing funding going to our NHS, because we know funding increases year on year by more than inflation, and a whole range of reasons for that, including staff wages, and obviously the consultants have had a significant increase in their pay, but also the costs of drugs, the costs of procedures. What we know is that, and what the Isle of Man Medical Society know, is that by reforming how we provide those services, we can be more efficient, we can see more patients per clinic, we can operate on more patients per operating list. And that's the way to really make sure that people on the Isle of Man get to see the benefit of the significant financial increase that's gone into the NHS. I mean, the Isle of Man Medical Society, and I must declare I'm a member of that, are obviously a part of the solution to some of the issues we're seeing by looking at their job plans, by looking at increasing productivity, seeing more patients, discharging those who don't need to be seen, and clearing some of the waiting lists.
The Society, though, has said that it would prefer to be looking at a restructuring of management layers in Manx Care and developing a private healthcare provision on island instead of going down this levy route. What are your thoughts on that?
Well, I thank them for taking part in the consultation. We've already had 1,400 people tying into this. It's going on for the next 12 weeks. I'd really encourage people to express their views. They seem to think that the NHS doesn't need any extra financial resources, doesn't need any extra revenue streams, and what they're looking at is reorganisation. And we know that the Department of Health and Social Care Minister, Claire Christian, has already said that what we need is some reform to the way the NHS is structured and functions, and we will be having a debate on this in this month's Tynwald. I think one of the other aspects they look at, though, is restructuring. I think we do need to look at the structure of Manx Care. We do need to make sure it's working for the people of this island. Their emphasis on private medicine, again, is a bit curious. I know that there's already been a commitment to reopen the private patients' wing at Nobles, but certainly my emphasis, and I know the Minister's emphasis, is really making sure that NHS care is maximised, we can reduce the waiting lists and make sure that people get the care and the attention that they need when they need it.
You mentioned that you thought the Society had perhaps slightly got the wrong end of the stick with this. Will you be reaching out to them and holding talks with them about this levy?
Well, again, this is a consultation, and I value their input. I have already replied to their concerns because they sent an email to me. And certainly there's a lot of work going on between the Minister, between Manx Care, and between the department with the consultants, but also all the rest of the staff that work in our healthcare service, particularly the nurses, the paramedics. I mean, we have some fantastic people on this island who've dedicated their entire life to providing safe, effective medical care to the people of this island. And I'd like to really thank them, but what we need to do is make sure they have the resources going forward to carry on this good work.
That's the Treasury Minister, Alex Allinson.
Thank you for making it to the end of the Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.